Hello, my name is Amanda Acker, and this is my presentation, Co-occurring Disorders and Recidivism, Evaluating Integrated Treatment in the Justice System. I want to discuss the critical flaw in our modern justice system, the way we handle individuals struggling with dual diagnoses, often people living with co-occurring mental health and drug abuse disorders, are funneled into the criminal justice system rather than receiving the specialized medical and psychological help they actually need. Men and women are treated differently. Mental illness and drug abuse often go hand in hand. Mental illness is often criminalized when it shouldn't be. As we look at the issue of addiction and mental illness, we see that men and women face different challenges within these systems. Unfortunately, the current trend is to criminalize mental illness rather than treat it as the healthcare crisis that it really is. Not getting these people the correct help and treatment is crippling for rehabilitation. The criminal justice system has an extremely high rate of having people in the system with co-occurring diagnoses. Up to 75% of the population in prisons have a mental health disorder, and over half have a drug abuse problem. The drug abuse makes recidivism rates a lot higher. Over half of all inmates struggle with a drug abuse problem. When these two factors collide without proper intervention, we see a direct impact on public safety, as drug abuse significantly drives up recidivism rates, the rate at which a person relapses into criminal behavior. Co-occurring disorders affect all people. There's no distinct gender component that we have to acknowledge. But women do tend to have more co-occurring diagnoses than men, studies show. This disparity is largely driven by trauma. Women in the justice system often face higher levels of past trauma, which serves as a catalyst for both mental health struggles and subsequent substance abuse. Understanding this gender-specific path is vital if we are to design treatment programs that actually work rather than just using a one-size-fits-all incarceration model. There is an issue with getting correct treatment for people with dual diagnosis due to costs. This makes them criminalize mental health, which makes recidivism rates a lot higher. Types of mental health diagnoses that come with drug abuse are things like mood disorders such as depression and bipolar, anxiety disorders such as generalized anxiety, panic disorders, and post-traumatic stress disorder, personality disorders such as borderline personality or antisocial personality disorder, psychotic disorders such as schizophrenia, and neurodevelopment disorders such as attention deficit hyperactivity disorder. If the need for treatment is so obvious, why isn't it happening? The primary issue with securing correct treatment for those with dual diagnosis is cost. Comprehensive integrated care is expensive, and as a result, many jurisdictions find it easier to process these individuals through the jail system. Why do these disorders lead to crime? Often, individuals self-medicate. A person with an untreated mental health issue like anxiety or depression may use drugs or alcohol temporarily to feel better. This creates increased risk because having a mental health disorder can change the brain's chemistry and function, making it more vulnerable to addiction. Then symptoms often become worse, like chronic substance abuse, which then eventually leads to crime or worse. Drug abuse often makes mental health disorders a lot worse. In conclusion, we must recognize that there are better ways to handle people with co-occurring disorders than the methods that we are using today. Instead of criminalizing mental health, we should adopt an integrated treatment method. Integrated treatment means treating the addiction and the mental health simultaneously under one clinical team. If we implement this, we could see recidivism rates drop and ensure that people are receiving the proper health care they need to become productive members of society. As I wrap up, I want to emphasize that we have tools at our disposal. Beyond just prison reform, we can utilize things like support groups, crisis intervention, drug abuse treatment centers, and other resources. By shifting our focus from punishment to integrated care, we can break the cycle of recidivism and offer a path to recovery for the millions caught in the justice system.